Schizophrenia is a very complicated mental disorder that affects 1% of the population, with more than 2 million of the diagnosed being American. Every year, about 100,000 to 200,000 people are diagnosed with schizophrenia. Not many are sure of the exact cause for schizophrenia, but some of the factors depend on the person's genetics and also the environment in which they grew up in. There are many things that are still unknown of this disease, and there are many discoveries every year. Schizophrenia is a complex disease with a complex history, symptoms, and the treatments for it. Schizophrenia is a very severe mental disorder that leaves its victims with many strange and sometimes scary symptoms. People with this mental illness have symptoms that include delusions, hallucinations, and movement disorders. People with schizophrenia often feel that others are out to get them and plotting against them. The symptoms are split into 3 different categories: positive, negative, and cognitive. People with positive symptoms lose touch with reality, and they are very disorganized in speech and behaviors. People with negative symptoms have difficulties with their emotions, feeling any kind of pleasure of being social. People with cognitive symptoms have trouble understanding information, their environment, and doing simple things. One symptom that is very noticeable in all cases of schizophrenia is depression. People with schizophrenia are very likely to commit or attempt suicide due to the things they hear inside their head. Schizophrenia not only affects the victim, but also the family as well. Schizophrenics with a more positive family are more likely to easily cope with this illness than those who are unsupportive. Not much is known about the real cause of schizophrenia, but it is linked more with the genetics of the person and also how they were raised. The history of schizophrenia is also just as complex as the illness itself. German physician Emil Kraepelin was the first to really notice that this was a different form of a mental disorder. It was only 100 years ago that the word schizophrenia was used to describe this mental disorder. Swiss psychiatrist Eugene Bleuler was the first to use the word and also split the symptoms into the different categories. Although schizophrenia was given its name only 100 years ago, symptoms of this disorder can be traced back into Old Egypt. Even the knowing of mental illnesses were known back in Greek and Roman times. In the medieval era, the symptoms of schizophrenia were often thought to be from evil demons or spirits in the body of the person. Since schizophrenia was first really discovered, there have been many ways to treat the mental illness. The medication that is given to the people with the illness does not make schizophrenia disappear, but makes the symptoms easier to cope with. The main types of medication are given to the patients are antipsychotics. With the help of antipsychotics, the delusions and hallucinations go away within a few weeks and the person begins to feel almost normal again. Although the symptoms go away, it may take longer for some patients because they need to find the right medication that fits best for them. People who stop taking their medication can relapse and go back to how they were before. Although, along with the taking of the medicine, patients can also use other treatments like therapy and self-help classes to help them gain back their social skills and how to feel normal again. Schizophrenia is a very strange mental illness that affects a person in many complex ways through the symptoms they have. It is also complex in the history behind it and the ways to treat it. Schizophrenia is sometimes a scary disorder because the person that has it will have it for the rest of their lives and have to find different ways to cope with it.